Welcome, everyone. It's really great to have Dan Sweeney with us. Dan is Senior Vice President of Healthcare at Relay Network. Dan, welcome.
Hey, thanks, Mark. Thanks for having me.
Absolutely. Well, there's a lot going on out in the world, and there's a lot to talk about. But before we kind of plunge into some substantive issues facing the industry, tell us a little bit more about Relay Network, what you folks do, and what your biggest areas of focus are.
Sure. Relay Network is a business that came to inception about 10 years ago out of Philadelphia, Pennsylvania. We have one key mission in life, which is to help our client organizations create members or customers for life. And in doing so, we do that through helping them build trust in the relationships. How do you build trust in 2021 and beyond? Frankly, you got to be engaging with them in a digital environment. So at our core, what we've done is we built products and services that allow institutions to build private networks of one-to-one digital connections between them, the enterprise, and their end users, whether that's in healthcare, their members or their patients, or you think about it in financial services with their customers or their account holders alike. It's all about how do I proactively deliver what will be the right unique message for the right individual end user at the right time in the relationship and allow them to take action quickly in what is a digital environment for heavily regulated industries.
That's so exciting and it's so important. One of the things that's happened during this pandemic that we're all trying to live through is there's been a wave in investments in digital transformation tools, and there's been a wave of adoption. But we're hearing that many of those tools have not produced great results in terms of patient engagement. How does Relay Health differ from the other tools that are offered in the marketplace?
That's a really good question, because when we think about digital historically, oftentimes the first things that come to mind are portals for members to go in and self-serve, or at the dawn of the smartphone, it was the mobile app. Hey, it's great. Everyone's going to download it. And then if we build it, they will come. And it just hasn't really come to fruition, right? Not to mention when you look at, the advisory network, Forrester is even saying that, portal utilizations and app downloads and engagement is plummeting, right?
Yeah.
The challenge is when you talk about all those investments that we're seeing in the digital marketplace, the vast majority of them today are happening on the back end in what we'll call data plays, right? So it's how do I segment my patient or my member data so that I know who are the right personas? The last leg of that mile is then we see marketing automation tools that are saying, okay, let's trigger for based on this persona, let's send them the following message. But what has gone uncovered or hasn't got enough attention is then what are the channels that we're leveraging in order to then deliver the final leg of the mile or deliver that right message to the right individual. When you talk about heavily regulated spaces like healthcare with a lot of HIPAA protections, this becomes really, really difficult. How do we deliver a message that needs to be secure and sit behind a firewall if we know that we can't get individuals to self-serve in a portal? And that's really the big challenge that Relay is tackling in the marketplace.
So you reach patients through a kind of a feed in your channel, correct? Can you explain a little bit about how that works?
Yeah, of course. So essentially what Relay's flagship product is, it's called the customer feed. It's a private and secure mobile website. So it runs off of the mobile web or it's browser-based, right? And what that does is allows us to pre-authenticate all of the end users for an organization, healthcare organization, so that you now have known customers in a private environment or known patients in a private environment. Once you do that, it becomes about proactively delivering the right end user into that environment at a time when they need to engage and have a customer service experience with the organization. So if you can proactively bring them in there, but it's still a tool that's built uniquely and directly for communication rather than as an information library or repository like a portal, it allows you to focus on engagement specifically and uniquely on what the individual needs right now, and then continue to engage from there. This is where the concept of the feed comes in. If you think about it, Mark, about 75% of all engagement on the internet today happens in feed-based methodologies, whether it's your Google results, ESPN.com, Twitter, Instagram, LinkedIn, you name it. The concept is, what if I had a private and secure HIPAA compliant feed that was a unique connection between patient and enterprise, and they always knew that all the prioritized information that they were going to require to take action on with you was going to be in that feed. Now I could come in based on where I am in the patient life cycle, and I could say, oh, it's time, it's flu shot season. Here's everything I know I need to know about flu shot. But then right below that, maybe I have my explanation of benefits. Right below that, maybe it's a message from a health coach, because the organizations know who I am. They know my persona. And they know, based on my disease states, that I should have access to this health coach and I should be engaging there. So the multiplier effect that's associated with a feed-based methodology says that the subsequent messaging below the primary is going to beget engagement rate lifts based on that unique first reason that I came into the feed, i.e., I was notified that it's time to get a flu shot.
So is part of what you're doing here successfully decluttering? Is that because, as you mentioned, so often people are involved in portals, and the portals are cluttered, and they've got a lot of extraneous information. But by moving into a feed-based mechanism, you're only giving consumers what either they want directly or what they've expressed that they might want from you. Is that part of the logic?
Well, it's an interesting concept, because I do believe that we are combating clutter. I think of clutter as what's going on in your personal email inbox, where today Mark is receiving 40% off from J. Crew, as well as messaging from the Chicago Cubs because you're in, Chicago, as well as your healthcare organization trying to cut through that clutter to get you to come into a portal. For the most part, I think portals are logically set up, but it's about the human condition and human behavior, where we say, not only do I not remember my username and password, but I'm not going to proactively be engaged enough in my healthcare at scale across an entire patient base where everyone's going to say, I'm going to go in and find what it is that I need. Yeah. Right.
Well, part of it is, I know, you guys are working in this area. All of us human beings who are in any way connected to anything electronic, meaning anyone not living in a cave, is constantly bombarded every day, right? Like, I am bombarded professionally, I'm bombarded personally. And it's very hard for me sometimes, and everyone I know says the same things, it's just like incoming, right? Like a million different things. And if you can have a channel that is more disciplined and focused, that's a really good thing, right?
You got it. Especially when I know that all the prioritized communications that I require between that relationship, right, that specific entity and myself, they're all going to be in one place.
Right. Exactly. So one of the things that's happened here, healthcare has been an incredible focus as an industry during this pandemic for obvious reasons.
Sure.
You don't have to explain it. But a weird kind of thing is happening where there's a lot of misinformation, even disinformation going on. And we're noting that Forrester noted in its 2022 predictions that the healthcare industry will no longer be in the trusted category because of the spread of information, misinformation, misunderstanding of health plans, distrust in health insurers, all different reasons. People are feeling a little bit, they're teetering a little bit, right? It used to be that healthcare was something that was unquestionably trusted. Hospitals were unquestionably trusted. So given that that's happening, how do you see patient engagement really resetting that equation so that trust is built back?
Yeah. And gosh, I really wish this wasn't the case, because I got to tell you, Mark, the executives and the teams that I work with day in and day out at healthcare organizations, they're whip smart. They couldn't care more about the end user. And they have all the right intentions. Let's put it that way. I think what's happening there is it's not for a lack of effort. So organizations are saying there's misinformation out there. in a moment like the pandemic, your healthcare institution is a great place for you to go for the right information,
Yeah.
right? What we need to do is we need to make sure that we can proactively get the right information to the right individuals at the right time. Healthcare literacy in this country is at like somewhere between 12 and 15% of the population. If you think about it, that means there's 85% of the individuals out there that we need to proactively spoon feed what is the right information that they need to know at the right time. It's not about just posting that information and hoping that individuals will come find it. We have to proactively bring the fight to them.
Right, absolutely. And I think that's especially true now. You know, there's it used to be said that the Chinese characters for crisis were danger and opportunity, but I've been reading that actually is not an accurate interpretation of those characters. But metaphorically, it makes sense, right? That in the midst of so much information flying around, some of it misinformation out in the world, some of it disinformation, hospitals and health systems and medical groups do remain trusted above many other sources.
Yes.
They have real opportunity to shore up that trust. Given the tools that your company is developing and implementing, and given the opportunity out there, as we hopefully move into a post-pandemic era as soon as possible, what role do you see digital health playing in that journey for patients and health plan members? Where are the greatest opportunities going forward?
Yeah, one of the key trends that you heard a lot right before the pandemic was the concept of the patient-centric approach to healthcare, putting the patient at the center of everything that we do. That hasn't gone away completely during the pandemic, but you hear about it a little bit less. I see us gravitating back towards that coming out of the pandemic. Mm-hmm. And historically, the first thing that they're looking to get right is the data. How do we make sure that all the data informs and can speak to one another through different systems when it comes to the patient? The last leg of that mile is going to be the communication component, where we need to centralize the communications. When you speak to patients, like what it is that they're looking for is they're looking for one front door into the healthcare ecosystem, right? We've started doing that across the last 5 years with the data on the back end. It's very much time, and I think we're going to see a proliferation of resources that are going to allow you to create one front door on the front end for the end user.
Well, to that I say hallelujah, because I think that consumers need that. And I think that, we've been talking about the empowered healthcare consumer for more than 30 years. And I can tell you that because I've been in healthcare publishing for 32 years. And I remember writing a cover story 30 years ago, literally, about the empowered healthcare consumer.
Wow.
Yeah, I know, right? So one could get discouraged, but I'm a glass half full kind of person. But I think what's happening now is I think consumers are becoming more empowered for two reasons. One, the technology makes it possible, and we can talk about that. But the other, I think, is that these younger generations really are navigating the world differently, right? They have the electronics at their fingertips at all times. They don't want to be, they're not going to be the people who are going to sit in a clinic waiting room for 4 hours for their appointment. They're just not going to do it.
Yeah.
And we have the technology to improve all this. And I think the opportunity for any service provider, any solutions provider like your organization, as well as for any health plan and any healthcare provider, patient care organization, is if you can grab the attention of the healthcare consumer and you can make them believe that you add value to their lives and add value to what they're doing and how they're navigating healthcare. I think that's a golden opportunity, don't you?
I do. I agree. I think that consumers at large in the United States are looking for that advisory. They're looking for the trusted advisor that can help to drive them in the right direction of what are the things that they need to take advantage of. From the the healthcare, payer perspective, if you just follow the dollars, right? You'd say that traditionally the vast majority of the spend in healthcare comes from a relatively small population of chronic disease states, right? For the most part, those chronic disease states are not the younger generation. So one of the things that they really need to focus on is, and I have a lot of dialogues that are around digital for the baby boomer generation that are now seniors, are no longer in the working world. And there's a fear that A, have they already adopted digital technologies? And B, if they haven't, are they just going to get left behind what are continued innovations when it comes to technology as they continue to age, right?
I think there will be a socioeconomic divide, which is very unfortunate. Those who are living at low economic levels, unfortunately, they will struggle. But everyone who's middle class is using technology. And one of the things that's been said, during this pandemic, the grandmas and grandpas, visiting with their grandchildren and great grandchildren on Zoom, they're using the technology. They're not, most are not afraid of it. I think that one of the things that's happened in this pandemic is we've had to use technology in many cases where it might have been an in-person or face-to-face encounter. So now everyone knows they can do it.
You're right.
And I think that that too is an opportunity. And I want to go back to something you said a few moments ago, which I completely agree with. The consumers are looking for that trusted advisor. And I will add one, Philip, to that, which is they're looking for the trusted but convenient advisor, right? I'm probably dating myself here, but I remember before the consumer internet, how hard it was to find things. You might go to the public library, or you might go to a bookstore, although that would be a chance-based thing that you would find what you were looking for. And you would hunt all over to find a piece of information. Now there's the Google and every other kind of search engine.
Yeah.
So we have a ton of information available to us, a world of information, but navigating it remains a challenge. And I think the more convenient that you can make something, a process and a relationship, by far, the more successful you'll be. Would you agree?
I would, but I'll use one caveat, Mark, to say you're absolutely right. The easier it is to navigate something, the better off we're going to be. The challenge that we see in healthcare at large is not enough individuals are proactively engaged in even attempting to navigate it, which is what's led us to this place in a digital environment in the first place, right? We're talking about a large scale problem here, where if we only have 12% of the population that's even proactively thinking on a daily basis, hey, what would help me to stop smoking? Or what should my diet look like if I have diabetes? Or where is the closest place for me to get a flu shot?
Exactly.
Right? What do we do about the other 78% of the population?
Yeah. And I think patient care organization leaders and health plan leaders, that's going to be the challenge of the next several years, because there are a lot of people out there, including with multiple chronic illnesses that they're living with, who are not engaged, who do not have a high level of health literacy. If anyone can help bring them in, that will be miraculous for us all.
You got it. And the good news is the tech is here.
Yes, that's right.
Like it's here today. We're ready to roll.
That's right. And, I recently interviewed a medical director at a health plan that serves the Medicaid population. In some cases, those health plans are giving people smartphones. It makes sense. That's how they keep track of them. They can do the reminders. Have you taken your medications? Have you gotten your prescription refilled? Here's your next appointment with Dr. Smith. And so they're handing out the technology because it makes sense. They keep their members engaged, and they keep them on their meds, and they keep them coming to their appointments. So
you got it. You got it.
The technologies.
From a data perspective, Relay Network today works with more than 50 different healthcare organizations. Many of those are payers. We are live in a variety of different audiences there, commercial, individual, as well as government programs like Medicare and Medicaid. One of the things you mentioned earlier about kind of the low income population, the data actually doesn't back up that these individuals do not have smart technologies or smartphone technology. What the lower socioeconomic class doesn't have is PCs. They don't have desktop computers.
Right. Right.
But like with the large proliferation of immigrants in this country, what we find is that so many of them have smartphone technology because they use it to call home.
Yeah,
right.
Exactly.
And for their next generation, for their children, that is their lifeline to the internet. So we have a lot of different programs in Medicaid with a lot of different payers, and we actually don't see degradation in the engagement performance across those normal lines of socioeconomic class or age profile, which is kind of interesting. I think translation, what that really means is, the proliferation of smart technology and utilization from US consumers at scale isn't something that's going to happen in the future. And it's not something that's just happening right now. It actually happened 5 years ago.
Right, exactly.
Yeah.
So let me ask you lastly, what do the next couple of years look like based on everything we've been talking about?
I think in the next couple of years, what we find is that healthcare service and support gets more and more personalized as technology helps us to enable sharper and sharper personas where we can identify not just what are the right things for Dan as a specific individual, but also allowing Dan to have a lot of two-way back and forth communication on what are the types of things and preferences of what types of use cases I want to hear from when it comes to healthcare. What is the type of messaging that I want to receive? And then also understanding that I don't think it's going to be nearly as much about preference engines in the future or what is the right channel for the right message. I think it's going to be more so about centralizing with that front door analogy to one channel that allows for guided service where you're proactively communicating in a hyper-personalized way to the right person at the right time so they can take action quickly.
Great. Thank you so much, Dan. I want to wish you all the best and your team all the best. It's an exciting time. There are more challenges than you can shake a stick at, but that also means there are more opportunities for smart people and smart organizations.
So, yeah, appreciate you having me today.
Absolutely. Thank you so much, Dan. So great to be with you. Thank you all to all of you in our audience for viewing this video. Thank you.